Hello everyone. When you diagnose with endometriosis, sometimes we choose the medical treatments, but sometimes we choose the surgical treatments. When we choose the surgical treatments, we have two options. One of them is laparoscopic excision. One of them is robotic excision. Maybe you can ask me, is there any difference? Or do these modalities, which one is better than the others? So we know that the robotic surgery is a little bit higher cost, but maybe when you pay more, maybe you can think that, is it better than the classical one, such as laparoscopic treatments? Our aim is when we face endometriotic disease in the abdomen or diaphragm or in another kind of tissue, we want to excise that abnormal tissue and get the organs in a normal anatomical conditions with a clear margins, and there is no disease behind inside the human body. When you apply the laparoscopy, we use some scopes. We enter the abdomen with a scope in an umbilical region, and sometimes we use the upper regions. It depends on the patient conditions. With the two-dimension image, we use some instruments. That instruments look like this one. We use that one, they are working like this one. But when you use the robotic surgery, we use the three-dimensional image. We use both eyes, but when you use the laparoscopy, commonly we use the one eyes because we see the two-dimensional visions. Under the three-dimensional visions with the robot, we use the articulated instruments at the same time. So we call that conditions is 1 + 1 is more than 2. And we know that conditions because we see a very good quality image because we use both eyes, and so we use the articulated instruments, and thanks to the robotic articulations and the movements, it is very easier surgery for the surgeons. And so we know that thanks to the robotic technology, we know that it's not so difficult when you perform the surgery under the three-dimensional visions. So currently, we know that this is the advanced level of endoscopic approach, and in future we know that thanks to the developments in the endoscopy and the robotic surgery, we commonly much more use the robots in the future, especially complex surgical cases such as endometriosis.